Thank you, Corrin, for getting us here today. Let's talk COVID-19. This is part 2. I'm State Representative LaShawn Ford, and I represent the Austin, parts of the Austin community, Oak Park, Berwyn, LaGrange Park, North Riverside, and parts of Proviso. And for our viewers, we want to welcome you and thank you for joining us for this very important webinar on a very timely topic. And the topic today is COVID-19 and the impact of COVID-19 on the mental health of African Americans, as well as the impact of long-standing institutionalized racism in the United States on African Americans. In today's presentation, we will delve further into diagnosis, testing, treatment, and vaccines as it relates to COVID-19. Part 1 of this very important topic took place on May 30th, where we focused on the origins of coronavirus, as well as its disproportionate impact on African American communities, as well as its impact on women and children, and that is pregnant women and children, as well as the health and safety of the entire community. If you missed part 1, you may access that by taking instructions from our friend Corrin Bradley.
Yes, when this is shared. We'll be linking part 1, which is located on Representative Ford's YouTube page, as well as in his Facebook Live videos, but we can reshare that if anyone wants to go back and check that out.
Thank you very much, Ms. Bradley, for your help in bringing together this event. And I want to remind people that you volunteer, and this is not just happening today, but it's a lot of work that went into making this happen. And I also want to thank the doctors. So we're very lucky to have 2 expert doctors, 2 well-known doctors in the world, not just Chicago. So let me introduce you. First, we're going to introduce Dr. Kimbrough Bell-Baylark. And let me just tell you why we're here today to talk about COVID-19. Dr. Kimbrough Bell-Baylark is an assistant professor of clinical medicine at Northwestern University Medical School and on staff at Northwestern Memorial Hospital. She is a board-certified internal medicine physician. She serves on Northwestern Memorial's Health Care Corporation's Quality Equity Committee and was recently appointed to the Illinois Health Equity Task Force. Dr. Bell has an extensive background in community medicine and served as a medical director of a federally qualified health center in downtown Chicago from 2001 to 2008. She has practiced internal medicine for over 15 years with a special interest in diabetes, hypertension, both diabetes and hypertension. Dr. Bell obtained her medical degree from Meharry's Medical College in Nashville, Tennessee. Dr. Bell has participated in various media opportunities, including Ebony Magazine, Northwest Indiana Times, the Chicago Tribune, and the Daily Southtown. In addition, she has been featured on various local news stations, including ABC, NMC, and Fox News. She was named as one of Chicago's top physicians in March 2006 issue of the Chicago Hospital News Healthcare newspaper. And so now you see why we're so lucky to have her join us for an opportunity to talk COVID. We also have another well-known doctor, and that's Dr. Dr. Crystal T. Clark. And she is an assistant professor of psychiatry and behavioral health science at Northwestern University Feinberg School of Medicine. She's a board certified in adult psychiatry and with a specialty focus on mood and anxiety disorder, and is on staff at Northwestern Memorial Hospital. She is internationally recognized for her research and expertise in the treatment of women's mental health. She serves as a director of advanced training in women's mental health and as an associate program director for general adult psychiatry residency training. Dr. Clark received her bachelor's of arts degree in psychology from Northwestern University and her master's of science and doctor of medicine from the University of Louisville. She completed her psychiatry training at Johns Hopkins in Baltimore with an MD. Dr. Clark has served as an expert on mental health topics such as suicide, medication and substance use disorder, and emotional wellness in the pandemic and civil unrest for media outlets, including the National Public Radio, NPR, the New York Times, ABC7, CBS Chicago, and Chicago Tonight. And so I think that we now recognize that we are lucky to have these two fine, well-accomplished doctors give their time on a Saturday to talk COVID. So I'm very happy to have you both. And I want to thank you, Corrin, and all the viewers for tuning in. At this time, I'll bring Dr. Kimbrough Bell-Baylark, who will speak to us today on COVID-19, our new norms and diagnosis, treatment, and testing, and vaccines. Dr. Bell-Baylark, the floor is yours at this time.
Thank you, Rep. Ford, so much for that introduction. And it's indeed a pleasure today to be able to take the time to share this very important information with our communities. And so we'll begin with slide 1. I'm just going to wait for the slide to come up. Okay, so COVID-19 pandemic, our new normal. So if you look in the upper left-hand portion of this slide, which, Corrin, can we make the slide larger on the screen?
Oh yes.
As we did before. Okay. So if you look in the left-hand portion of the slide, you'll see a photo of the virus. You'll see a photo of the virus that's responsible for catapulting our country and the globe into a literal tailspin. A photo of the virus that's responsible for the first pandemic of this magnitude since the Spanish flu of 1918. A photo of the virus that was first believed to have been identified November 17, 2019 in Wuhan, China. And a photo of the virus now responsible for our new normal. And just take a moment to look at the graphics I've depicted on this slide. Our new normal. Next slide, please. I want to share with you a bit in regard to COVID-19 statistics as of July 17, 2020. So in the United States, there have been over 3.6 million cases, total number of diagnosed cases. And I emphasize diagnosed cases because there's many out there who do not realize that they have COVID-19 or who have yet to be tested. So actually the number is probably quite larger than this one. And there's been over 140,000 total number of deaths within our country. And if we look at the state of Illinois, there have been over 157,000 diagnosed cases of COVID and over 7,000 deaths. And then within Cook County, where the majority of the viewership today lives, there have been over 97,000 diagnosed cases and over 4,700 deaths. And as we all are well aware of, there's been a disproportionate impact within the African American community, which we touched on quite a bit more in part 1 of this presentation that took place in May. And we will touch on it a bit more later in today's presentation with Dr. Clark. Next slide, please. The novel coronavirus is how this virus was initially referred to, as it was novel or new, meaning we had never seen this particular virus before anywhere in the world. So COVID-19 stands for Coronavirus Disease 2019, as the virus was first identified in late 2019 in China. The virus that causes the disease known as COVID-19 is called SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome Coronavirus 2. As you may recall, we had a much smaller pandemic in 2002, 2003 known as SARS. It was very deadly as well, but fortunately did not affect nearly as many people. There are 7 different coronaviruses, 4 of which are benign, harmless. As a matter of fact, everyone listening on this call today has likely had coronavirus at some point, as it is a common cause of the common cold, or actually it causes up to 30% of the common cold. However, 3 of these 7 coronavirus strains are deadly, and 2 of those 3 are SARS-CoV, which was in the early 2000s, and now currently SARS-CoV-2, which is the virus responsible for the COVID-19 pandemic. The third one is MERS, which stands for the Middle Eastern Respiratory Syndrome, and it was first reported in Saudi Arabia in 2012. Lastly, as you can observe in this commonly seen image of the virus, the spike-like projections are similar in appearance to a crown. Corona means crown, thus the name coronavirus. Next slide, please. Now, many have asked, where did this virus come from? The origins are believed to be from a particular species of bats in a province of China. It is felt that these bats may have infected other animals, and then there was animal to human transmission. Next slide, please. I wanted to speak a bit on transmission. So this schematic demonstrates how we prevent transmission, use of masks or face coverings. If 2 people are interacting, as you can see on this schematic, one COVID positive and one COVID negative, if neither is wearing a mask, obviously the risk of transmission is very high. If the COVID negative person is the only one wearing a mask, there is still a pretty high risk of transmitting this infection. However, if the COVID positive person is wearing a mask and the COVID negative person is not, the risk of transmission actually drops dramatically. Furthermore, if both persons are wearing a mask, then the risk drops even further. And if you throw in social distancing of at least 6 feet apart, then the risk is even lower. In addition, with the social distancing and frequent hand washing with warm water and antibacterial soap for at least 20 seconds, and use of an alcohol-based hand rub, or AKA hand sanitizer, that has at least 60% alcohol. So ultimately, washing with soap and water is preferred. But by practicing these measures, these are the ways and the only ways that we will be able to help control the spread of COVID-19. Next slide, please. So just for further clarification, when you wear your mask, Rep Ford, you are protecting others in case you have COVID-19 and don't know it. When others have on their face mask, they are protecting you, Rep Ford, from COVID-19 in case they have it and do not know. So many persons mistakenly believe that by wearing their mask, they are protecting themselves from getting COVID-19. And yes, this is partially true. But the primary benefit of you wearing your mask, Rep Ford, is that you are protecting others from getting the disease in case you have it and do not know it. Next slide, please. So now we're going to move into part 2 of my talk today, the COVID-19 pandemic. And we're going to focus on diagnostic testing, antibody testing, treatment, and vaccines. Next slide, please. So the CDC recommends a COVID-19 test called a nasal pharyngeal swab. The technician will put a special 6-inch cotton swab of both sides of your nose and move it around for about 15 seconds. It won't hurt, but it may be uncomfortable. They'll send the swab to a lab to test the material from inside your nose. Although a nasal and throat swab is the preferred specimen for detecting the virus, testing on saliva has recently been suggested as an alternative method. Now, the use of saliva has several advantages, and when they collect this test, it's basically spitting basically into a tube or a cup, and then that is tested. And the use of saliva has several advantages. So one, it is easier. It's less uncomfortable to take saliva than to do a nasal swab. It may reduce the risk of healthcare workers or reduce the risk to healthcare workers if they do not need to collect the sample. And it reduces the consumption of personal protective equipment and swabs. This is particularly important in settings where there might be a short supply. But it's not as sensitive as the nasal swab, meaning that it may state that the result is negative when actually it is positive. This is believed to be due to the fact that there is a lower concentration of the virus in saliva as compared to the nasal swab. So ultimately, the preferred method of testing is the nasopharyngeal swab. As you see in the slide, indicated in the slide here, there's a nasal swab and there's a nasopharyngeal swab. And with the nasopharyngeal swab, it is inserted further within the nose into the back of the throat, and there is a greater chance that the virus will be detected and collected if it is present. Next slide, please. We're going to share a video with you.
Have the patient blow her nose into a tissue to clear excess secretions from the nasal passages. Tilt the patient's head back slightly so that the nasal passages become more accessible. Instruct the patient to close her eyes to lessen the mild discomfort of the procedure. Gently insert the swab along the nasal septum just above the floor of the nasal passage to the nasopharynx until resistance is felt. Rotate the swab gently against the nasopharyngeal mucosa for 10 to 15 seconds. Gently remove the swab and place it into its container.
So that's just a brief video just depicting how the specimen is collected. So that's testing as far as trying to diagnose if one has an active or a current infection. Well, we all have heard about antibody testing. So antibody testing is actually a simple blood test. And in my office, I've had many patients who come in to see me who say, Dr. Bell, I was really ill about 2 months ago. I never got tested for COVID, but I'm just curious, might that have been COVID that I had? Can I have an antibody test? And so that's where I find myself most often in scenarios such as that, ordering the antibody test. And there is no shortage of supply, so you can go to your doctor and get this simple blood test done. But you do need an order from the doctor to have it done. To explain this test a bit more, so first it is a blood test. And so when we take this test, it lets us know if there is the presence or the absence of antibodies against COVID-19. If the test does come back positive, it does not mean that you currently have the infection. It basically is telling us that you had the infection at some point in the past. What we don't know is if the presence of these antibodies actually confers immunity. So in other words, will having the presence of these antibodies prevent you from getting reinfected with COVID-19 at a later date? And the answer to that question, we do not have just yet. So if you get an antibody test and it does come back positive, as of now, all we know that tells you is that you did have the disease at some point in the past, whether you knew it or not. It does not tell us if indeed you are protected from future infection. Next slide, please. So I want to talk a bit about treatment, but before I go more into treatment, I wanted to talk some about transmission, just to refresh us about how exactly the COVID-19 virus or SARS-CoV is actually transmitted, and then we will go more into the treatment. So we do know that COVID-19 is known to be transmitted primarily by respiratory droplets, secondary to sneezing, coughing, or simply talking. It is also potentially transmitted through though less commonly, by touching objects that have the virus on them, which could potentially be infectious for up to a few days. So if one were to come into contact with these items, such as a door handle, and then touch their eyes, they could potentially become infected. Symptoms can manifest differently in different people. Some persons may experience mild disease that may only consist of sore throat and a dry cough. Others may experience fever as high as 102, 103, extreme fatigue, severe shortness of breath, and ultimately these persons may require mechanical ventilation in the intensive care unit, where they may suffer from a severe viral pneumonia. And the lungs is an area that this virus has a special predilection for. So typically one who has a more severe case with COVID-19 is because the virus really focused on the lungs and led to a severe viral infection. We now know that some individuals can be asymptomatic, but if they were to come into close contact with a vulnerable individual, such as an elderly person or someone with chronic kidney disease, chronic lung disease, diabetes, things that are actually quite prevalent in the African American society, they could potentially have a life-threatening illness that they received from someone who was asymptomatic. In general, 80% of persons who contract COVID-19 will have mild to moderate disease. They will recover at home and not require hospitalization. 13% will have severe disease requiring hospitalization, and 6% will require mechanical ventilation in the intensive care unit. So the odds are in favor of most people, but regardless, caution is strongly advised. So treatment. Supportive care. So for cases that have very mild to moderate symptoms, which is about 80% of cases, as I just stated, supportive care is the primary treatment, which basically means remaining at home, quarantined away from others, treating symptoms with over-the-counter medications such as Tylenol or ibuprofen, rest, lots of fluids, and most persons will recover within 10 to 14 days. And according to the CDC, it is safe to resume contact with others if you meet these three criteria: 3 days with no fever, and respiratory symptoms have improved, and 10 days at least since the symptoms first appeared. Also, according to the CDC, if you were asymptomatic but tested positive for COVID-19, you could be around others after 10 days since having taken the test. So then next there's convalescent plasma. I know we've all heard that term in the news. So what is this? What is convalescent plasma, you ask? So people who've recovered from COVID-19 have antibodies to the disease in their blood, as we spoke about earlier. And so the blood from people who've recovered is called convalescent plasma. And plasma is the liquid portion of the blood. So researchers are hoping that this convalescent plasma usage can be given to people with severe COVID-19 to help boost their ability to fight the virus. It might also help keep people who are moderately ill from becoming more ill and experiencing COVID-19 complications. If you've had COVID-19 and you recovered from it, consider donating your blood through the American Red Cross or your local donation center. This is not yet a proven treatment for COVID-19, but it does look promising, and as stated, it has been used in some cases. So next, the antiviral remdesivir. So according to the National Institutes of Health, the investigational antiviral agent remdesivir is recommended for the treatment of COVID-19 in severe patients who have severe disease, who are hospitalized and have an oxygen saturation in their blood that is low, secondary to the impact of the virus on their lungs. And also for those who require the ventilator or supplemental oxygen. So it's believed that the use of this particular antiviral drug can actually shorten the course to recovery, or shorten the time from infection to recovery in these patients who have severe disease. So in other words, they get better faster, as opposed to those who have not used this drug. And the drug works by blocking the spread or replication of the virus inside of the body. So steroids. Patients with severe COVID-19 can develop a lot of inflammation in the body, referred to as a systemic inflammatory response. And this can lead to lung injury and organ dysfunction. So it has been proposed that the potent anti-inflammatory effects of steroids might prevent or mitigate these harmful effects of the virus. So patients who were randomized in a trial to receive dexamethasone, which is a type of steroid, had a reduced rate of mortality compared to those who received just the basic standard of care. So for patients that meet certain criteria, the NIH, or the National Institutes of Health, does recommend consideration of use of this drug, and studies are ongoing. And there's other investigational drugs that are being looked at also that I will not go into in this presentation because trials are still early. Next slide, please, Corrin. Vaccine. I think that's the topic of the day. Everyone's asking, when will we have this vaccine? When can we really feel safe again? So when we think about vaccines, there's a couple things we want to think about. One, we want it to be safe and effective. A vaccine should confer immunity. And then we'll talk a little bit more about what the timeline is for development. So while vaccine development can take years in some cases, researchers aren't starting from scratch in regard to developing a COVID-19 vaccine. And this is because there's been past research on SARS, as you heard me mention earlier, and MERS, which are both types of coronaviruses. And so there's already been some research that has identified some potential approaches. So we're not really starting exactly from A. We're probably more so around M, if you want to use the alphabet as a comparison. So that's helpful. That's helpful. As you heard me mention earlier, coronaviruses have a spike-like structure on their surface that looks like that crown. Thus the name corona. And this is called an S protein. And so this S protein is what attaches to the surface of human cells and infects them. So a vaccine that targets this particular protein would prevent it from binding to human cells and stop the virus from reproducing. So why does it take so long, you ask? So first, a vaccine is tested in animals to see if it works and if it's safe. This testing must follow strict laboratory guidelines and generally takes 3 to 6 months. The manufacturing of vaccines must also follow quality and safety practices. So then next comes testing in humans. So small phase 1 clinical trials evaluate the safety of the vaccine in humans. And during phase 2, the formulation and doses of the vaccine are established to prove the vaccine's effectiveness. And finally, during phase 3, the safety and efficacy of a vaccine need to be demonstrated in a large cohort or a large group of people. Because of the seriousness of the COVID-19 pandemic, vaccine regulators might fast-track some of these steps that I just mentioned, but it's unlikely that a COVID-19 vaccine will become available sooner than 6 months or so after clinical trials start. And clinical trials have started. So realistically, a vaccine could take 12 to 18 months. That's on the fast end, or longer to develop and test in human clinical trials. And we don't know yet whether an effective vaccine is possible for this virus, but research is going on as we speak, and we're being optimistic that we may see the first vaccine hit the market in the next 6 months or so. So we're hopeful, So in conclusion, next slide, please. COVID-19 is here to stay, for now at least. Let us not become complacent. Diligent use of face coverings and social distancing is essential. We've all seen in the news where many states have had to roll back to the previous phase because of a sharp uptick in new cases. And I'm really concerned, as is our mayor, that Chicago may be the same. Right now, we are seeing an uptick in the number of new COVID cases. We are seeing an uptick, especially within our younger population, who tends to congregate more at bars and social gatherings. And so if we don't heed the words of the CDC, and if we don't heed the words of our mayor and our governor, Chicago will likely have to roll back to our previous phase. Testing is important, and asymptomatic infection does exist. Positive antibody testing does not mean immunity. There is encouraging news for treatment, and vaccine development is crucial, though the timeline is uncertain. So I want to say thank you to those of you for listening today. And at this time, I'm going to transition to Dr. Crystal Clark, who will give us more information in regard to the mental health implications in the African American community of COVID-19 and the racial pandemic. Dr. Clark.
Right, thank you, Dr. Bell-Baylark, for that very informative presentation, and really talking about and underscoring the need for diligent facial coverings and social distancing at this time. I want to also thank Rep. Ford for giving me this opportunity to speak about mental health in this time, because we know physical health is extremely important and paramount, but we often forget about mental health and how important that is, as well as we're trying to protect ourselves against this invisible enemy and also dealing with the racism pandemic. Next slide, please. So Dr. Bell-Baylark has talked about this coronavirus, COVID-19, and we know that it has hit Illinois pretty hard. 156,000 plus people have been infected with this virus in Illinois. And in addition, we've lost over 7,000 people to this virus. But what we know is that 30% of the Chicago population is African American. But 60% of the Black community has been infected by this virus, and 70% of the fatalities due to COVID-19 have been in the Black community. This has led to increasing anxiety and fear and trauma and grieving just in being in the midst of this global pandemic, and really speaks to just a part of what's taking a toll on our mental health. Next slide, please. So we know that COVID-19 has been extremely disruptive. Weddings have had to be canceled, baby showers, people can't get together for, just the typical social gatherings that we would normally participate in that are also important social outlets for taking a moment away from a busy work schedule or a stressful day. We haven't even been able to do our usual congregating in church and have had to turn to virtual platforms to even worship. We have also not been able to grieve and have that closure of having a funeral when we have lost a loved one. And that has been major because we have lost our support networks, at least in the sense of physical support networks. Next slide, please. So what does that mean on our mental health? Well, we know that the lack of social connection can raise one's health risks as much as 15 cigarettes a day. So that's pretty profound. I mean, we know how bad cigarettes are on the body, which is why many people don't smoke these days. So just thinking that the lack of social connection can cause that type of health risk is profound. And we know that the psychological effect of confinement is powerful and can lead to depression and anxiety. So when I say social connection, I just want to emphasize the need to, yes, be socially distant. We've learned how helpful that is in keeping us physically safe. But it does not mean you have to cut off your social connection to your loved ones, your friends, your trusted circle. Find ways to connect with them, whether that's virtually or whether that's sitting in an open park 6 feet away from each other with a mask on. It's very important for your mental well-being. Next slide. So let's talk a little bit about anxiety. You might wonder how, not only are we dealing with this invisible enemy, but why is it that anxiety is getting worse? How is it that you can be at risk for developing an anxiety disorder or even depression in this unprecedented time. But what we know about anxiety is that when it's important for us to have a little bit of it. It's normal. We all need a little bit of anxiety. We need that anxiety when we're walking down a dark alley and we hear footsteps behind us. We feel our heart rate increase, our senses are more alert, we're prepared to run or flee if we need to. But when that person passes us and we realize they have no desire to do anything with us, the anxiety drops. So you peak here and it dissipates and you go on with your evening and you're fine. Well, what we know from the pandemic is that our anxiety went up here. We were all worried about this invisible enemy, about getting sick, about losing loved ones, and we're seeing these loved ones leave us because of this illness. And the anxiety has just stayed there because we're still trying to protect ourselves, right? So we're just here. We're just riding right here. And that's chronic stress. And that chronic stress, if we're not in tune to it, can lead to intense, excessive, and persistent worry and fear, which leads to anxiety. And that chronic anxiety can lead to depression. Now you see the line there in this graph on the right side that shows escape. Now, some of us have decided, okay, I'm tired of dealing with this. You know, it hasn't been that bad. Maybe your personal experience is that you haven't lost anyone and you decide to avoid or deny what's going on in the world. And so you don't deal with the mask. You don't deal with the social distancing. I encourage you not to succumb to that avoidance because that is something that people try to do to protect themselves. It's a coping mechanism. You have to continue to protect yourself physically, but doing things that also keep you mentally well. Next slide, please. So if the COVID-19 pandemic wasn't enough, especially in the Black community and the health disparities we've seen there, seeing another fatal killing or killing of an unarmed Black man in our world has really been the tipping point, right, for our mental health. Next slide. So again, the losses of in the Black community, the COVID-19 have already just been traumatic, but as we continue to see the loss of unarmed Black people, that being Ahmaud Arbery, Breonna Taylor, Michael Brown, and Trayvon Martin, and so on and so forth, that collective cumulative emotional wounding across generations is extremely traumatic and impactful to our mental health. Next slide. So I want to take a moment and just go over what are anxiety symptoms, what are PTSD symptoms, and just in case anyone out there is feeling these symptoms, so that you know to seek help. Anxiety is really that difficulty concentrating. All of a sudden, you just can't stay focused. You can't get your work done. You're easily distracted, excessive worrying. You're worrying about everything. Some of those worries, of course, may be appropriate, but you just can't, your mind can't rest. You have difficulty sleeping. Those worries are keeping you up at night. You might be feeling more irritable or short-tempered. And some people find themselves self-medicating, not only with substances such as alcohol or marijuana or other illicit substances, maybe even with food, carb craving, excessive eating. So you have to, if those are symptoms you're experiencing and they're persistent, you got to think about that and think about seeing a mental health provider. But what about PTSD? So PTSD, you might feel numbing of your feelings, like you just feel blah. You're just not enjoying things as much, more irritable, easily startled. Often, we know this, we see this often with PTSD and veterans with PTSD where they can't sit in a room without their back in a corner so that they can see all angles. They're easily startled. They see danger everywhere. Also, it affects sleeping, and people feel constantly on guard with PTSD. Next slide. So what about depression? As I mentioned, chronic anxiety can be a trigger for onsetting depression, as well as PTSD, but also this isolation that we're experiencing and trying to navigate the stress of being in these pandemics can also lead to an onset of depression. We know that 13.4% of the population is Black, and that over 16% of the Black community have a mental illness in any given year. That is over 7 million Black people with a mental illness, more than Chicago, Houston, and Philadelphia populations combined. But what is depression? So let's just review the symptoms of that. And again, appreciating that if you have more than a few of these symptoms, you need to seek evaluation from a mental health provider. So symptoms include, I'm just moving my pictures here, your fatigue, sadness, sleep disturbance, loss of interest, might be unable to enjoy things you used to enjoy. Maybe you used to enjoy running. Maybe you used to enjoy reading. You're just unable to do that anymore and receive any pleasure from it. It's also feelings of hopelessness and worthlessness and feelings of guilt. Change in appetite, again, that carb craving, or maybe you just have lost your appetite altogether. You just don't eat. You might be oversleeping, sleeping 12 and 14 hours, or undersleeping where you can only get a couple hours a night. In the worst case scenario, you might have suicidal thoughts and want to end your life. All of these symptoms, if they persist, if you feel that way more days than not, just, everyone has a good or a bad day, but if you're feeling that 3, 4, 5 days, it's important to seek help. Next slide. So the psychological effect as I have described, persistent negative emotions can lead to depression and anxiety. And we have to really guard our brains from being stuck in that negative emotional place. Next slide. So ways in which we can maintain healthy emotions is to find safe ways to connect with loved ones and friends each day. Again, we're in phase 4, as Dr. Bell Baylark has really impressed upon you guys. You really need to keep those masks on and social distance, but it's still important to safely connect with one another. Maintain a daily routine. What I mean by that is get up and shower each day, put on clean clothes, eat nutritious meals, stay active, and then you limit the use of substances such as alcohol. If you find that you're drinking more in this pandemic, that's a warning sign. If you find that you are smoking more, that's also a warning sign. So be mindful. Next slide. And manage negative emotions or thoughts. So we know that watching the news, experiencing some of the things that have happened due to the pandemic, like losing a job or losing a loved one, can leave us in a negative space in which we're just kind of ruminating, just kind of going over and over in our head about all the terrible things that have gone on. So you have to check in with yourself daily and just see how you're feeling. Take a moment to focus on what you have. Take 15 minutes a day to write down the things that are bothering you and then put them away, symbolically placing them on the shelf so that you can free your brain. Decrease the time you spend watching or listening to upsetting media coverage or posts on social media, because those, as we all know, get us pretty upset, especially these days. And then take the time to meditate. Now, meditation may not come easiest for all if you've never done it, but I promise you, if you keep doing it, it will get better and it's extremely helpful. Of course, focus on your spirituality if you are a spiritual person, and be mindful, maybe adopt doing yoga. Next slide. Finally, again, when to seek help is if you are having persistent symptoms. You're just not feeling yourself. If you find that you're not functioning the same, you can't get out of bed. If any of these, any type of symptoms or worries are bothering you excessively, it's time to seek professional care. Next slide. And so I'll leave you with these resources from NAMI, the National Alliance of Mental Illness. We have a Chicago chapter. You can always call the number as you see listed here and look for local therapists, counselors, psychiatrists. The same with Depression Bipolar Support Alliance. These places also have support groups for family members. And Taraji P. Henson's Boris Lawrence Henson Foundation is also a great resource, and she's been wonderful in providing additional resources during this time. Next slide. Finally, I just leave you with some other resources that are really geared to the Black community, including Therapy for Black Girls, Sister Afia, and Black Emotional and Mental Health. Last slide, please. Finally, if you are in the Austin area, along with Rep. Ford, and you are someone who has experienced domestic violence or sexual assault, this is definitely something that has been on the uptick due to the pandemic. We do have resilience there. They have an office there that, with resources that are extremely helpful. Finally, I'll leave you with mindfulness, some resources there in the mindfulness app. Last slide. One more. With that, I say safety first and be mindful. Thank you.
You're muted, Rep. Ford.
Yeah. All right.
Okay.
Okay, so thank you so much, Dr. Baylard and Dr. Clark. I think that Northwestern is very lucky to have you, and your patients, I'm sure, are better off because of you. Your presentation was very informative, Dr. Baylard and Dr. Clark, so thank you both for that. And Corrin, thank you for being timely with your thinking, making sure that you continue to move forward. The presentations were very beneficial, especially for the Black African-American community. And at this time, let's transition into questions and answers with the doctors.
Yes, yes, absolutely. I know one of the things that is very common and gets brought up all the time is the sort of mistrust that is in the Black community in terms of like vaccines and seeking medical attention about that. And I just want to know too, from like a mental health perspective and also from an actual medical, like people treating people perspective, like how do you guys feel like we're going to approach that going forward?
So, well, I'll start, and I'm sure Dr. Clark may have something to add from the mental health standpoint. But I think we all know that as African-American persons, and we look back at our history, and we look back at the history when it comes to various medical treatments and procedures, et cetera, how often we were used as experiments. And probably one of the most commonly talked about is the Tuskegee experiment. And so we have to be honest with ourselves, and there's still many, you know, within our community and population who are still very, very wary when it comes to certain treatments, testing, getting involved in research trials, et cetera, because of our past. And I think that it's important for our medical professionals, and especially our African-American medical professionals, to help dispel myths that these types of things are still taking place today. And having been one who's been in the medical community working for 20 years now, I can say that is not taking place today. And I think it's very important that myself, Dr. Clark, and others like us help to dispel this myth, you know, within our community, and to try and impart the importance of us partaking and participating in trials, so we can learn more about how we as African Americans would potentially respond to certain treatments. And in regard to, say, the vaccine for COVID, knowing how our communities are disproportionately impacted by this disease, and that it would be of vital importance that we felt safe enough to get the vaccine in order to protect ourselves and our families and our friends. So I'll turn it over to Dr. Clark.
Yeah, I absolutely agree with Dr. Bell Baylard. Corrin, it's really about us providing education and giving our community space to really get the answers they want so that they can feel comfortable with moving forward with the vaccination. Of course, it would help if our news and science could be consistent too. I think it help us all. But I think doing platforms just like this, whenever the vaccine comes out, and really getting making sure that people have access to the information and ability to ask the questions that they need to get answers to so that they feel comfortable.
Oh, that's fantastic. And I know, speaking to another topic and something that's really been circulating with my generation especially, just because we do a lot of sharing on Instagram and TikTok and whatnot, a lot of people are speaking to pandemic fatigue. Just that idea that we still know it's happening, but it's so like because we have been in it for such a long time, we're getting careless with how that goes. And so I just want to know if you guys can speak to that. I know you're still treating patients, and I can only imagine now, like with that. But I know you offered some advice, but just going back into that.
So I'll start. It is exhausting, for lack of a better way to put it. And we are seeing COVID-19 fatigue. And I kind of mentioned that in the slide about that desire to escape and just say, forget it, I'm done, I'm tired. And we have to guard against that because we don't want to be forced to be stuck in our house again and maybe in a worse way from another surge. So I encourage people to, now that we're in phase 4, actually what I'm telling people to do who are really like, I got to get out. I'm just saying, look at the things that you can do to keep yourself safe. And that's being in a open outdoor space, keeping your 6-foot distance. People have, decided they want to hug again. Okay, no, let's not do that yet. You can still bump elbows and get together. You can still have a small barbecue, a small gathering with your mask. And if you choose to eat or something, then, be distant so that you can eat safely. But I encourage people to do that because it's really hard to stay confined and isolated like this. We're just meant to be social beings. And so we just can't continue this way and not feel like we just want to run. So I encourage that, of course, checking in with family more because people are staying more isolated. So people aren't seeing friends and family as much, but remember we do have FaceTime and Zoom and all of these different platforms if you have those, the equipment for that accessible. So I recommend doing those things and not forgetting to take care of yourself. I'll turn it over to Dr. Bell-Baylor if she has any other ideas.
Yes, I don't really have anything else to add. I agree 100% with Dr. Clark. So I think, again, just underlining that the most important thing is that, no, you don't have to be quarantined within your house. It is okay to go out, to get out. But what's most important is the wearing of your mask at all times and also practicing social distancing, when you can. So that's truly the most important thing.
Absolutely. And another thing too, I know that we addressed this in the last webinar that we had, and I know you spoke to it, you touched on it in your presentation, Dr. Baylor. A lot of people are worried too, anxious about that second wave. And I know that from what we're seeing from the states that open too fast, I think the general idea, and I know it's a little complicated to understand because of all of the different news outlets and who's reporting what, about how those states are still in their first wave because they open so fast and that moving along. But I just want to know your thoughts on the second wave. And I know because some places the numbers have gone down, in other places the numbers are rising. Do you think we're going to be entering something that'll look a lot like the pandemic when it first began? Or do you think maybe it'll come back but not hit as hard? And I know that I'm not speaking national, I'm mainly speaking to Illinois and like how you guys feel about that.
Well, I'll start with that one. So first off, there's still a lot we don't know about this virus, but we do know a lot more than we knew March 1st. And so, and I think in my opinion, one of the most important yet simplest things that we know is the way to really try to effectively prevent spread is, again, the use of face coverings and social distancing. So back during the point in time where our numbers were so high, we can't necessarily say that we were vigilantly doing these things as we are doing them now. And so, yes, I do think that there will be a resurgence of the virus in the fall as we move forward. But as far as how impactful or detrimental this will be is going to be on us as individuals and how we are protecting ourselves and to help, mitigate the spread. So I think that's what's going to be most important, that we continue to do the vigilant hand washing, that we are wearing our face coverings anytime we leave our homes and are in any proximity of other individuals, that we are socially distancing. Those are the only ways we're going to be able to help slow or stop the spread, short of having to regress to a previous phase.
Absolutely agree. I don't have anything else to add to that, but I definitely agree.
Okay. And then one of my final questions for you guys, and this is speaking to current events. I know recently we've had, I imagine the medical community has had a blow with the decision of our federal administration to bypass the CDC and have the reportings go back to them. And I know that we are lucky here in Illinois to have a governor and in Chicago to have a mayor that has been very diligent about informing people and pushing for the face coverings and with the phases and all of that. But I am wondering if you guys have had any experiences in treating patients or just encountering any other talks you've given or within the media, because I know you guys do often interact with them, the pushback on that from because the federal government is been so lax about it versus our state government, or if you're encountering people that are very, no, I'm not going to do that, this isn't real, all of that.
I can start with that one. I think, that particular announcement is pretty new, so I haven't seen patients really talking about that yet. But the mixed messages has definitely impacted how patients engage and behave out there in the world. And it's really what I'm seeing is mixed behavior, just different approaches. And because they're confused about, like Dr. Bell Baylock explained, the mask is protecting the person you're talking to or the person you're around. They're wearing the mask to only protect themselves, and then they don't care about the person that they're around, mainly because they don't understand. So, there's just been so much mixed messaging around how to best stay safe and is this a real virus or not. And I think the desire to not be in this pandemic can also be a strong force for helping people to not think in the best way about this pandemic. So I have to remind people the numbers globally are not being made up. This is real. No, this would take a major conspiracy for every country to be, saying that people have died and have this illness. So I have to remind people of things like that. But I think regardless of where the virus or the cases are being reported, at the end of the day, we have to remember we are still in a pandemic. We still must protect ourselves. It does not matter what numbers you see or don't see until we have a vaccine and people start getting it in mass numbers. We are still in this pandemic.
Yes, I agree with Dr. Clark. And again, I think it is most unfortunate that we are getting the mixed messaging that we're getting from the top down. I won't go any more specifically than that, but I do think that it's quite unfortunate. And I think that it has played a tremendous role, to be honest, as relates to the number of cases that we have here in the United States, the number of deaths that we have here in the United States, because when you have mixed messaging and you have leading agencies and government administration that aren't in agreement with the facts, it does lead to mass confusion. It leads to division. It leads to more death. And it's quite unfortunate. But I do look at the Centers for Disease Control as one of our leading agencies that is putting out good, solid information. The National Institutes of Health, Dr. Anthony Fauci and his organization are all highly reputable organizations for us to get our information from. And I will leave it at that.
That's good. Another question has come in about how you guys feel on the school reopenings. I know that there's been a lot of mixed messaging, and as of right now, the state is moving forward with in-person and also virtual learning combo. But what are your thoughts on that?
Dr. Bell-Baylock, I'll give that one to you.
Oh, you're going to get that. That's a tough one. That's a tough one. That's a tough one because I think that all of our gut instinct is that, wow, we're going to unleash all of these children coming from various communities, throughout Chicago, back to school in a classroom. The teachers, I can see their concerns. It's a tough one. I've heard some different thoughts in regard to how that return may or may not look if children do return. I've heard individuals say that it's thought that perhaps 50% of children will return on Monday and Tuesday. The other 50% will be doing e-learning, and those 50% who are in school will be socially distanced and wearing their mask and having lunch at their desk. And so there's different proposals that are coming out as to how potentially that return to school could be safe. And I am curious myself to know, what that would look like, because it's important. You also think about if we don't return to school because, say, we cannot find a safe way in which to do so. We have to think about our children, especially our children who come from more disadvantaged backgrounds, whose parents are essential workers, who won't be there to help monitor and moderate their learning and making sure they're doing it. Will this further lengthen that achievement gap that we already suffer from and deal with as African Americans? So it's such a difficult thing, and I'm not sure what it's going to look like for the fall, and I can't really offer much more than that, except that I pray that we'll be able to come up with the best decision that'll be most beneficial for all when it comes to education as well as protecting our health.
Yeah, Dr. Clark, from a mental health standpoint, how does that look for children that's not able to interact with their peers and have to be stuck home with their parents, and parents have to be stuck with their kids?
Well, I am sure some parents and the kids could probably tell you a lot about how they're feeling right now. It's definitely been hard on kids not to see their friends, especially we're in the summer. Normally, people will be out playing sports or doing something at camps, mostly of which are closed right now. And, I've been encouraging parents to really, they gotta get creative, unfortunately, which is a lot on the parent, and come up with activities that keep the kids occupied, and again help them find ways to check in with their friends or safely social distance and get together. Because, like I said, for the adults, isolation can really weigh on your mental health. So they're just as in much need to have that social connection, and it requires the parents. Sometimes we're having Zoom parties. Before we were in phase 4, Zoom birthday parties and things like that. Now they can get together in a more safe social distance way. And I encourage people to do that. Of course, it's hard with kids because they don't like to keep those masks on. So you gotta make sure to, kind of sanitize their hands and all those things, and put together as many precautions as possible. And with the parents, it's really about finding some me time, taking a moment, and that can be hard when you're all kind of confined in the house. So again, now that we can get out, if it is a 2-parent home, or if there's a trusted relative, just finding a way to take that time, that moment for their own mental health is extremely important.
I used to teach, and one of the things that happened when I was a teacher, I always caught a cold. I would always catch a cold because those classrooms, and I don't want to say maybe it was the teachers, but pretty much children carry a lot of, I guess, viruses. So this is a different one. So, those classrooms are filled with germs. So,
yeah. I was just going to say, it's going to be hard. I agree with everything that Dr. Bell-Baylock said. they're gonna have to get really, really creative. I mean, it's not a perfect answer to this situation. I don't think on either side. They're gonna have to get really creative if they do open the schools back about when people are coming in, how they're sitting in the classrooms, meeting them at the door with, hand sanitizer and doing the temperature checks and all of those things. And then having a protocol for what they need to do if someone does have a fever or does have symptoms. I think it's going to take a lot of very thoughtful planning.
And I think another thing that we cannot forget is that in this age of COVID, the common cold does still exist.
Right.
Every cough is not COVID. Every fever is not COVID. I know Rep Ford commented earlier when he saw me cough. Earlier, I don't know if you guys saw me cough earlier, but every cough is not COVID, and so it makes it even probably more confusing because as we go into the fall, we all know that most of us get a cold or something in the fall and the winter season. We have flu that's coming around real soon, and I have a feeling this year that we may run short on flu vaccinations because I have a feeling this year that more people than usual are going to want to get their flu shot because I think that people are going to want to try to feel that, okay, I got my flu shot, so hopefully this is not the flu, just to be able to kind of better determine what may be going on with themselves. So this fall in general, when it comes to our common cold, flu, and now COVID, will be quite an interesting time because they all present similarly.
Yeah, and you talked about the anxiety level being here, Dr. Clark. I think that everyone wake up and go to bed thinking about this.
Yes.
I mean, so that, a cold, a cough, no matter what, we all think that. So how do we, and sore throat? So it's a mental, right?
Yeah. No, it is. I mean, we're paranoid now. So
right, exactly.
Anytime someone coughs, even if it's yourself, you're like, oh gosh, what does that mean? Am I okay?
Right.
Yeah.
Or as you said, it's good to have some of that anxiety because it protects us also. So hopefully we all know that we have to cover our mouths when we cough because now we know that it could be deadly for some people.
Yes.
Yeah.
Any more questions, Corrin?
As of right now, no. I was going to say Dr. Balark went on to talk about what I was going to ask about, which was like keeping up your regular health, like flu vaccinations, normal doctor checkups. Like I know you should be getting a physical once a year. I'm trying to be better about that as an adult. But I know that keeping those things up. I was going to say, like, I can only imagine, or if you are like, are you still seeing patients about other things or like, is that still happening? Because I know coronavirus is at the front of everyone's mind. So in terms of just like people who are regulating and doing what they would normally do to stay healthy, is that still going on or is that still happening? Are people just coming in to see physicians normally or getting their like regular therapy sessions where we're not always talking about the disease or whatnot? Like, are those things?
I know what you're saying. Yes, they are. We have been slowly, ramping back up at Northwestern as other hospital institutions are as well. And I can definitely say that my practice has been very busy and I'm seeing tons of physicals because so many physicals had to be rescheduled and canceled back when we weren't seeing patients at the height of the pandemic. But I would say of the patients who come in to see me, our conversation in regard to their health care, probably 80% of it is actually non-COVID. I mean, there may be a little bit of mention, about, oh, how are you dealing with the pandemic? Have you been safe? We have some basic conversation like that, but I would say that 80% of cases, the primary overarching thing is something other than COVID, whether it's their physical examination or follow up on their diabetes, hypertension. And then you bring about a very good point, Corrin, that it's always important, obviously, to take care of your health and to make sure your diabetes has been properly managed, et cetera. Yeah. But, and even more important now, because we do know that these, many of these comorbidities and within the African-American population can tend to lead to a worse outcome with COVID. And so it's even more important that we're being sure to take care of ourselves and keeping ourselves as healthy as possible. But yes, but things are definitely ramping back up, and it feels pretty normal in the sense that people are taking care of their basic health, in general. So
that's a really good question, Corrin, because we know substance use disorder is on the rise. We have more overdose from heroin, opioids on the west side and throughout the state because some people think that it's because of the anxiety of the COVID and not being able to go in to see their primary physician to receive prescription drugs or getting their substance use disorder drugs. So that's a good question, Corrin. Dr. Clark?
Yeah, to your point, Rep. Ford, about substance use being on the rise, it's definitely, it's the anxiety, it's the depression, it's the loss of jobs, it's also being isolated and kind of bored, like, what am I doing, where people are not, they don't have those distractions of it. That's always a typical daily structure that's keeping them kind of focused on their sobriety. But then on top of that, you have clinics that are not open. So substance use is really a mental illness in which you really need to have the infrastructure to support sobriety. So having group therapy, seeing your therapist, your sponsor and all of that, having AA meetings. So a lot of it clearly has become more remote and and everyone doesn't have the laptop, the cell phone to participate in those remote groups and things like that. But with that said, we are doing lots of virtual work. Lots of virtual work is available for those who do have some type of virtual platform. Offices are starting to reopen from the mental health side of things as well. I personally am still remote. As I mentioned, I take care of a lot of women, particularly in the pregnancy and postpartum phase of life as well. And they are not trying to come out, understandably so. And a lot of it actually can be done very well virtually. So I encourage people, if they're having any trouble, to really reach out, because it doesn't mean they have to come in or take any risks to, be exposed. They can do a lot of this over the phone, even telephone appointments. It doesn't even have to be a virtual platform. It could just be calling in, and they can talk to their doctors about medications and explain the symptoms, mental symptoms they're having.
And one thing I wanted to piggyback on Dr. Clark, because she brings up a good point. I know as a psychiatrist, she does do the majority of her work, at least currently, more virtually or via telephone in this current state. And I was speaking earlier about patients coming in to see me, but in the height of the pandemic, we were doing virtual office visits as well. And one thing that I can say as a result of COVID-19, I do think that telemedicine is here to stay. So even though I am seeing patients in office and have a high demand for patients who want to come in and see me, there are still some who don't still feel really good about coming out to be seen, as Dr. Clark said. And so I also offer telemedicine visits as well as the other physicians in my practice and most of the other physicians at Northwestern. So we're now mostly doing a mix, which is a new thing as a result of COVID. And I actually think it's a great thing. I think even beyond COVID, there will still be a place for telemedicine. So, yeah.
So Corrin, is that, should I go to closing?
Yes, we can wrap it up. Thank you so much. This has been so informative. And I know that the community is very grateful. I really do think it means a lot that you have given the answers that you have, and you're really pushing the facts and the science, because it's always nice to be reminded of that.
Yes.
And so thanks for that.
Yeah. And so Dr. Clark, thank you very much. And Dr. Baylark, thank you. And I heard you say, Dr. Baylark, that this is here to stay. And if we continue to see the uptick in the virus, I think we're going to need you all to come back, because it's going to be a impact constantly on our health, and the second wave could possibly impact us even heavier on our mental health. And so hopefully we could have a commitment from the two of you doctors to come back and continue to keep us updated on how we should be dealing with the impact of COVID-19. And of course, we need Corrin to be committed also to do this. So thank you both for this information, and thank you, Corrin. And I would just close by saying I want to thank the mayor and the governor, as all of you have, because I do believe that they're not saying anything from their personal belief. What I hear them saying constantly is the facts, what the CDC and they're following the medicine. And so I think that whether people want to do it or not, I think they should continue to follow what the mayor and the governor is saying here in Illinois, because they're really following the facts, and they're not telling people what they want to tell them for their personal feelings. So with that, I want to thank you all.
I agree.
And, we shall see each other again soon.
All right.
Thank you.
Thank you.
Thank you, Rep.
Thank
Ford.
you.
Good.
All right.
Bye-bye.
Bye.